plastic and reconstructive surgeon based out of Reno Tahoe, Nevada. My practice focuses on aesthetic surgery of the breast, body, and face. Really have a particular interest in emerging technologies and minimally invasive techniques such as radiofrequency skin tightening. AccuTite is a great new technology for a number of reasons. It's a bipolar radiofrequency device and it's minimally invasive. You can use it from head to toe, from the periorbital area to the knees to the axillary area. So patients really like it because it's a procedure that can be done in the office under local anesthesia. It avoids general anesthesia, it avoids the operating room. The access point for the device is just through a needle stick, so it's really minimally invasive, and most importantly, the results are excellent with the soft tissue tightening that the AccuTite can achieve. So it's interesting because in plastic surgery we've become very good at treating younger patients who may want things such as preventative skincare, peels, fillers, lasers. And then we become very good at treating the patients that are on the older spectrum with excisional procedures such as facelifts and abdominoplasties, for example. There is a large group of patients in the middle group that we call the treatment gap. And those are patients maybe in their 40s, late 40s, who we don't really have a great solution for. I think excisional surgeries on those patients sometimes can be overkill, but they still need a solution for aesthetic concerns that they have. So these minimally invasive technologies are really excellent to help those patients in a minimally invasive way to achieve their aesthetic goals. AccuTite is great. It's been great in my practice because a lot of my patients can really use localized areas of skin tightening, and certain areas are just not amenable to traditional surgery. So for example, after breast augmentation, if a patient has a little bit of axillary fullness, I don't have a great solution for that without using minimally invasive radiofrequency treatments. So before and after surgery, there are options that do not require classic excisional procedures to address those concerns. I think this new technology is transformational for patients because, first of all, I don't blame patients. They're scared about having traditional operations. I mean, I've never had an operation and I hope to never have one. But a traditional operation is a scary thing to have. I mean, you're dealing with anesthesia, you're dealing with operating rooms, and if you can achieve the patient's aesthetic goal in a procedure room using a minimally invasive technology, that's preferable. That being said, operating room is a safe place. It's safer than crossing the street. But just from an emotional and recovery standpoint, it's better to achieve your aesthetic goals in a minimally invasive fashion without traditional operations. We have Julie here today. She's a 38-year-old female, otherwise in great shape. She just has a concern of extra skin around the knee area. This is a very common complaint of women in this age, extra skin around the knee area, around the arms, between the breasts, and these areas are very hard to treat. There's no real great solution for tightening the skin in this area. This is the AccuTite device by InMode. It is a bipolar radiofrequency device. And what we're going to do under local anesthesia is treat the knee area and lower thigh area, tighten that skin, and smooth out the contour to improve the overall aesthetic. So we're going to go ahead and numb up the area. We're going to place this cannula under the skin using an 18-gauge needle and heat the tissue to tighten it. She just has a concern, localized concern, of extra skin around the knee area. If she lifts up her leg, you can really see there's just a little bit of extra skin here that she's bothered by. Before radiofrequency, there really wasn't a great solution to treating this. So we're going to go ahead and treat her under local anesthesia with bipolar radiofrequency and heat this tissue and tighten it over the next 4 to 6 weeks. So we're going to start this procedure just by making a little access point here. We're going to inject local anesthesia. This is just 1% lidocaine, just a little pinch, with epinephrine. And the nice thing about the AccuTite device is that it can be accessed through an 18-gauge needle. So I'm just going to make an 18-gauge needle stick here, and then I can insert the cannula directly and treat this area. So I'm going to put a few cc's in on each side, just to numb up the area. And this is just under straight local, and we're going to use some tumescent to just numb up the area that we're going to treat. But she hasn't had any Valium or any kind of other pain medication. So this is a nice way to tighten the skin in the office. So this is the 18-gauge needle. I'm just going to come in through that through that point that I just put some local in, and just gently fill this area with tumescent. Patients usually feel just a little burning and pressure, but typically not much pain if you go slowly in a controlled fashion and just numb this whole area. This is really the hardest part of the procedure. So in her case, I'll probably end up putting in about 80 cc's per side. You know, once I start feeling some firmness, then I can move on to another area. So this is a really nice technique to use in the office because, you know, you don't need any kind of special equipment. This is just plain tumescent like you would use for any other local procedure. So the concentration of tumescent here is 1 gram of lidocaine per liter, and I made up a 500 cc bag. We also put some bicarbonate in it and also some epinephrine for the vasoconstrictive effect. So this is a really nice solution for these localized areas of skin laxity in patients such as Julie who have a little bit of skin laxity that they want treated, or in patients who have had previous surgery and have a little bit of recurrent skin laxity that needs to be treated, such as after a facelift, for example. If you wanted to treat recurrent jowling, this would be a great modality for that. Before we start the radiofrequency treatment, we need to place some aqueous gel. This is just ultrasound gel, water soluble. And this is going to allow for easy gliding of the bipolar radiofrequency device, the AccuTite, and also allow good conduction of the electromagnetic field, which will allow even and consistent heating throughout this tissue. So here's the AccuTite device. This cannula is going to go under the skin, and it's just 18 gauge in size, so we just have to find the needle hole we made, and it should go right in. And we're just going to pre-tunnel a little bit, just for ease of treatment here, and that's it. We're going to start. So here you see we're activating the device on retrograde motion, and it's heating the tissue. Feel it? So here you can see I'm activating the device on retrograde motion, and it's heating the tissue. I stop the device about 1 centimeter from the entry port so I don't continuously heat that area. And I like to heat the tissue systematically so that we heat one section at a time. The audible noise tells us what temperature we're at, and as we hit a triple beep, that means we've reached target temperature. You doing all right? Okay. So just slow, even heating. You felt that? Okay. What I'm going to do is treat this tissue in a counterclockwise fashion just for consistency. So I'm going to start the treatment in a retrograde fashion. Feel that a little bit? How about there? That's okay. And we're going to heat all this tissue above the knee to target temperature and really get good tissue tightening throughout this area. So we should expect about 30 to 40% tissue contraction over the coming 2 months or so. And as you can see with the AccuTite, the tissue heats rather quickly. So it's a great way to achieve a better contour of this area. And you can actually hear the tissue contracting underneath. You hear that crackling? It's like a shrink wrap. So just slowly heating the tissue, reaching target temperature in a systematic fashion. It's all under local anesthesia. She's quite comfortable. And the nice thing is you have external and internal temperature controls, and it really keeps you safe without even looking at the device. So you know exactly what temperature you're at and when you should stop treatment. Sometimes in an area like this that has a concavity or convexity, you can hold the tissue firmly taut so you're more at a parallel direction to the skin edge, and that's helpful for treatment. So that triple beeping means we've reached our target temperature settings, which in this case is 68 degrees Celsius internally and 38 degrees Celsius at the external skin surface. And at those temperatures, you're going to get collagen, new collagen formation and new blood vessel and elastin reorganization at about 4 to 6 weeks. We've seen this in histologic, animal, as well as clinical studies. So as you can see, this is a relatively straightforward procedure in office. You could imagine there's many different areas you could use this on: axillary rolls, above the knee area, around the waistline, in particular after an abdominoplasty, when patients may have a little extra skin or extra area of fullness. Oftentimes we combine it with liposuction if needed. When treating an area like this, I can really treat both knees from one area without really too much of an inconvenience. So I'm going to go ahead and treat this area through this one access port. This is an 18 gauge needle hole, and I can get all around this knee, and then very easily I can treat this whole area as well. So it's a convenient way of tightening skin in the office just under local anesthesia. Okay, so we'll do the other side. What I'm using here is the stamping technique. So I'm staying in one area, heating it to target temperature, almost like placing rivets. This is a little bit more of an advanced technique to tighten the tissue because you're more likely to get a burn if you stay in one area for a longer period of time. It is more efficient, in my opinion, as far as heating an area more quickly and moving on to the next area. So what I like to do is just move a little bit slower, target this whole strip of tissue to the right temperature, and then move on. So really moving very slowly, reaching target temperature, stamping that heat, tightening the fibroseptal network, and then moving more proximally towards the incision point. And I want to stop about 1 centimeter away from the access port so I don't heat it every time. I don't cause a thermal injury there every time I come towards that area. So just very slowly stamping to the triple beep. Another technique that people use is moving continuously, like this. That's also effective. It just, in my opinion, takes a little bit longer, but a perfectly good way to do this. So you could either do the stamping technique or you can move it continuously. The nice thing about the AccuTite is the heat is very localized, so you can really get to target temperature pretty quickly. And the device really tells you where you are from a temperature standpoint to make sure that you're heating appropriately. The results here are going to last for a long time because we're developing new collagen formation, so it's as if you had a reorganization of the skin underneath. So that tightening should last for many years until gravity takes effect again. Usually the patients don't really see any skin changes. You may have some redness or just some irritation to the skin, but nothing significant. There's no real visual endpoint to this treatment, just the temperature. I prefer to use temperature as my endpoint rather than a number of joules because every patient is different. So typically after we reach desired temperature, we'll sit on that area for about 30 to 60 seconds just to make sure that that area is evenly heated. So that's what we're doing here. You doing all right? Good. Yeah, and then Julie's tolerating this very well, just under local anesthesia, nothing else, here in the office. Just by nature of the heat, we're going to remove some of the fat in this area to kind of mold this area and tighten the overlying skin envelope, which is really the benefit. This AccuTite device can also be used on the face, in the jowl area, neck, axillary rolls, eyebrow, lower eyelids. There's a lot of different applications for this. So we've really liked it, especially the small cannula size, rapid heating, and ability to use this in the clinic. This is a small cannula, so you shouldn't really develop more scar tissue than you would, certainly not more than you would with liposuction, which is a far bigger cannula. So really, we haven't experienced much scar tissue with this device. It does tighten the fibroseptal networks underneath the skin, which is desirable, and leads to more collagen formation. So all in all, it's a very safe and effective, minimally invasive technique. Sometimes patients will notice a collagen band form after treatment, especially in the neck area, but that softens over time and actually, to us, demonstrates that there is new collagen formation significant enough to cause a visible banding. So usually patients are good with just Tylenol, Motrin afterwards. We really don't require too much more. The tumescent should last a couple hours at least, so you shouldn't really feel much pain at all. Sometimes we'll pass a liposuction cannula after this treatment just to discontinuously undermine the skin and remove some of the fat that has been killed by the heat. But in an area like this, it's going to absorb, and we don't really have to worry about undermining because the skin is well adherent and doesn't really have any contour deformities. So post-op, typically I'd have her elevate her legs to avoid increased swelling. This is a difficult area to wrap just because of where it is around the knee, but if it was another area in the body, you could consider wrapping it for compression. I would avoid any kind of strenuous activity for about a week. And that's it, just Tylenol, Motrin for pain, and we'll see her in about a week. And that's it, we're about done.